We're going to resume. All right. And the next item on our agenda, County Manager's Report. We have two items under the Manager's Report. The first is the Safe Sharps Disposal, and Dr. Mullendor will head up this presentation along with others. Be a team effort like that.
All right, Chair Newman and Commissioners, thank you for this opportunity to speak to you tonight. So as we all know, the ongoing opioid and injection drug use epidemic has raised significant public health concerns, including those about overdose deaths, communicable diseases, and unsafe needle disposal. We have heard stories in these meetings, and many of us have stories of our own about seeing used syringes on the ground in our community, or clogging up toilets in public housing complexes, or of employees at local businesses or sanitation workers suffering from needle stick injuries from syringes that were thrown into regular trash cans. And I think it's important for us to remember that syringes are used by a wide swath of our population. People use them to inject substances that are illicit, like heroin and other opioids, methamphetamine, but we also have many medications these days that are injected, from the longstanding insulin as well as many rheumatologic and autoimmune medications. And so we need to recognize that there is an increase in the use of syringes by many people in our community, and that we need to make easy access to disposal a priority. And so Buncombe County is starting to explore, or continuing to explore, opportunities to make safe needle disposal more accessible to residents. So working on increasing public awareness about what safe disposal of sharps is, to invest in community organizations that are engaged in trash pickup, to provide them with tools and training to ensure that they're safe, and working with solid waste department, so I know Dane is back there, working with the solid waste department to increase the availability of sharps disposal units throughout the county and public locations. So Dane is working on finalizing expansion of household sharps disposal access points in the county to include the landfill, as well as the sole site currently, which is at the transfer station. So I think that we have great opportunities to make it even more accessible to people in our community. With regards to communicable diseases that are potentially related to injection drug use, this is a graph from North Carolina Local Health Director Region 2, and so that includes Buncombe, but also Avery, Burke, Caldwell, Henderson, Madison, McDowell, Mitchell, Polk, Rutherford, and Yancey counties. And so this is looking at acute hepatitis B confirmed cases from 2012 to 2016. And we can see the significant rise in acute hepatitis B over these years in this region. Recently, the North Carolina Department of Health and Human Services reported that from 2012 to 2016, newly diagnosed cases of hepatitis B in the state increased by 62%, and newly diagnosed cases of hepatitis C increased by 200%. In North Carolina as a whole, acute hepatitis B virus exposure through injection drug use has also been increasing since 2014. And the highest rates of acute hepatitis B in North Carolina were among residents in Western North Carolina. This graph shows, again, Region 2. This is looking at acute hepatitis C confirmed cases, and you can again see the increase from 2012. The most frequently reported risk factor by people with acute hepatitis C virus infection is injection drug use. And we know that acute hep C exposure through injection drug use has been increasing since 2013, and again, the highest rates of acute hepatitis C in the state are being seen in Western North Carolina residents. We know that hepatitis B and C are very hardy viruses and can live for days to weeks outside of the body, and we know that they're very highly infectious. I think when people think about injection drug use or a needle stick injury, they first get worried about HIV, which is fine and appropriate, but hepatitis B is 100 times as infectious as HIV, and hepatitis C is 10 times as infectious. So we know these things are very easily transmitted through injection drug use. For HIV, again, the North Carolina Department of Health and Human Services reported that in 2017, there was a 22% increase in newly reported HIV cases in Western North Carolina compared to the prior 3-year average, and the increase in the proportion of people with HIV reporting injection drug use as their risk factor. And there is a high rate of co-infection. So people with HIV aren't just infected with HIV, they're often infected with hepatitis B and potentially even hepatitis C. And the CDC has recognized that Western North Carolina is vulnerable to an outbreak of HIV, similar to that was seen in Scott County, Indiana several years ago, small rural community, high rates of poverty and unemployment. And so people were sharing their injection drug use equipment in a county that saw very few cases of HIV a year, had an exponential increase to over 100 cases in a year. And so the state has been very highly focused on Western North Carolina. They were out here recently exploring and investigating a network of injection drug users in the western part of the state where they were seeing an increase in HIV and hepatitis cases. And then something that isn't necessarily reportable disease to public health, but are things that we know, we're hearing from Mission Hospital, that they're seeing increases in infectious endocarditis, so infection of the heart valves related to injection drug use, a very costly treatment, weeks of intravenous antibiotics for this, which again is a burden on not just the individual suffering from that, but our entire healthcare system and community. And so just looking at taking that data down to our local level, this is data from Buncombe County, our acute hepatitis B cases. The 2017 data is not yet finalized. It's supposed to get finalized by the state this week. But you can see that over the past 4 years, we have had cases of acute hepatitis B that are associated with injection drug use, hepatitis C as well, and then HIV, not as much in our area, but we have had cases associated with injection drug use. And then something that people don't necessarily think about with injection drug use is invasive group A strep. So group A strep is the strep that causes strep throat, but if it gets in the wrong part of your body, so if it gets into your skin or soft tissue, it gets into your bloodstream, this is what causes what is commonly known as flesh-eating bacteria, right? It's that type of infection. And so we have seen that several of our cases last year were associated with injection drug use. Not necessarily something that is on the tool, the investigating tool for our public health nurses, but we have some very wise public health nurses, and so they've asked the questions and found this, and so the state's actually going to add this to their screening tool in the future. And so a public health approach to reducing the spread of communicable diseases through injection drug use is harm reduction. And harm reduction strategies are all about reducing the harmful consequences of drug use and other high-risk behaviors. And they operate on a spectrum of safer use to managed use to abstinence, right? We know, I know in my clinic work that it's really hard to go in and talk to somebody who's a smoker or who's engaging in sexual activity to go and get them to become abstinent all of a sudden, right? That's not my reality. And it's the same way with drug use. And so we employ harm reduction strategies routinely. Medication-assisted treatment, which at the opioid town halls you've talked about or heard about, medication-assisted treatment with methadone or buprenorphine. Condoms are a harm reduction strategy, right, to make sex safer. Nicotine replacement therapy is a harm reduction strategy for smoking cessation. So we employ these methods routinely to help people reduce the harmful consequences of high-risk activities. And harm reduction strategies for safer drug use recognize that people use drugs for a variety of complex reasons, and they seek to meet people where they are in order to address both the reasons for their use and the drug use itself. And it provides an opportunity to engage and establish trust with a sometimes very hard to reach, stigmatized, marginalized population. And the hope is that the relationships that are built will lead to folks getting into care and treatment for their medical conditions, which include their addiction. And so this is a graphic from the CDC. I think you guys may have a copy in front of you. This is what they look at as like the ideal components of a syringe exchange program. And just to give a little background on the law, so on July 11, 2016, North Carolina law allowed for the legal establishment of syringe exchange programs run by governmental and non-governmental organizations in the state. And the law requires free access to syringes and injection supplies in sufficient quantities to prevent sharing or reusing of supplies. They require distribution of educational materials about disease transmission and overdose and addiction, consultations or referrals for mental health treatment and substance use disorder, and naloxone training and distribution or referral for distribution, and then secure disposal of the used syringes and injection supplies. And in the 2016 law, there was a specific prohibition of the use of public funds to purchase syringes and injection supplies. And then last year, with the passage of the STOP Act, that included language that would allow local funds, but still not state funds, to be used for purchasing the syringe exchange supplies. And the North Carolina Communicable Disease Branch of the Division of Public Health has really sought to integrate syringe exchange programs into other programs that have shared goals of prevention and treatment and care for HIV and viral hepatitis and sexually transmitted infections. And so when I look at this graphic and I think about our clinic, we do a lot of this already. So we clearly provide hepatitis A and B vaccination. We provide testing for HIV and hepatitis and link people to treatment and care. We offer the tools to prevent HIV and hepatitis through education and counseling, through provision of condoms. We do post-exposure prophylaxis currently for HIV. We screen people for substance use disorder and try to link them to care. We screen for mental health services and try to link them to care. So the things that we don't currently do are we don't provide naloxone for overdose prevention. We don't necessarily advertise safe disposal of needles and syringes. Clearly, if somebody brought in something they wanted to dispose of, we could take it and put it in our sharps containers. And we clearly don't do provision of syringe injection supplies. But we would like to take this opportunity, especially as we move forward or move back to our clinic's location at 40 Cox Avenue, to look at expanding our services to include these things, as well as to include pre-exposure prophylaxis for HIV for high-risk individuals. And then potentially even considering having a peer support specialist available either on call or in the clinic to be able to engage people who are ready. This slide is to show that syringe exchange is mentioned as part of the state's opioid response. This is from a presentation given by the section chief of the Chronic Disease and Injury section of NC Division of Public Health, and it talks about how syringe exchange is a way to engage people who are already caring about their health and to get them connected and to care for their addiction. This is a map current as of April 30th of this year that shows the counties that currently are served by syringe exchange programs. This is showing that there are 29 active syringe exchange programs that cover 34 counties. I would say that we know that at least one of our syringe exchange programs locally, and probably both, definitely see people coming from other counties, surrounding counties, to get services. So I'm sure more counties are served by syringe exchange programs, but even though they might not have syringe exchange programs localized within their county. And so locally, we do have two syringe exchange programs. The Needle Exchange Program of Asheville, which is run out of WinCap, is located in their office on Fairview Road in Oakley. And they've been around for decades. Michael Harney, who's here, started this back in the mid-90s, if I'm not mistaken. And they were last year dispensed over 500,000 needles to people from 32 counties and 4 states. And then we have the Steady Collective, which operates out of 2 locations, Haywood Street Congregation and Firestorm Cafe, Books and Cafe, out in West Asheville. And in 2017, they averaged 7.5 hours of outreach a week and distributed 73,000 new syringes. And they are currently receiving some funding from the county. And I want to acknowledge the staff of NEPA and Steady who are here tonight, because I know some of them are here. So if you would raise or stand or do something to recognize yourselves. These existing syringe exchange programs have worked really hard for years, and in the case of NEPA for decades, to protect individual and public health in our community. And we in public health are very grateful for their service and dedication. And commitment to an often, like what we mentioned, often stigmatized and marginalized population. And I truly believe that without their services, the numbers of hepatitis and HIV cases in our county would be much higher. I think that they have helped shield many people from those infections. And so our next steps at this point are to continue to collaborate with the Needle Exchange Program in Asheville and Steady to identify areas of unmet need for syringe exchange and harm reduction in our county. Something that has surfaced in some conversations thus far is the need in our community for a mobile unit that would get out to outlying areas of our county where people are unable to come into to get services. And so that's something that has come up that we'd like to explore. And then we would also want to learn from the North Carolina Health Departments that have syringe exchange programs currently. So there are 3 counties, Orange County, Wilson County, and Cabarrus, where their health departments have syringe exchange programs. And so I've connected with all of them, and I'm trying to learn from them about what type of model they use and what's worked, what hasn't worked. But we need to recognize that people who use drugs may not be comfortable coming into a government agency and willingly talking about their drug use. I mean, we ask those questions of clients currently in our clinic, but they're coming to us for other services. And so we anticipate that hesitation will be there, and especially at 40 Cox Avenue, where we have deputies present in the lobby. We know that is a potential concern that may be a deterrent to people coming to us. So I just think we need to recognize that. I think we need to continue to support the existing syringe exchange programs. There's no way that a clinic-based syringe exchange program would ever be able to meet the demand that they have met so well over the many years. I think that there are different populations that are served by the different programs and different opportunities, and so I don't want to take away from what greatness they've been able to accomplish in our community. And so based on all that information, we would like to design a clinic-based syringe exchange program for our health department, Health and Human Services, and consider it another access point for the community. And then going back to what I started out with, we really want to focus on educating the public about safe sharps disposal and make it easier for people to safely dispose of their sharps throughout the county. So if you have any questions, and we have experts in the room clearly, but I thank you for your time.
Great, thank you very much.
So I've got a comment on this. I think that, people can be torn with this issue. And so, for me, personally, and there's quite a few that think the way that I do, I think, that, I don't think anybody's really interested in promoting bad behavior when it gets down to it. I'm not. But I do support saving lives. It is and should be a goal of this county to compassionately reach out. I do think that abstinence can be a reality with compassionate counsel and family and faith support. I do think that all of these things can work together to achieve the goals that I believe that you're after. And I thank you for your presentation, and I thank those that have passionately came in and presented many, many times for this and have listened to our advice to come in and do it. It is something that people are torn, you know, with their deep beliefs. And but if we can save lives in Buncombe County, then that gives those that believe in outreach through faith an opportunity to exercise that. And I see this as something that gives that opportunity. And for me, I thank you for coming and presenting it.
Thank you.
I want to thank you too, Ed and Michael. We know now that heroin is a whole different ballgame. It's a disease of the brain. Nobody intentionally goes down this path. And if someone had cancer, we would never, ever think of not giving them treatment. And addiction, it's not a choice. People become addicted. We know now that 8 out of 10 people that are addicted to heroin started with legal prescriptions. So I think this is just one part of what we can do in our community, but nobody wants to be addicted to heroin. Nobody wants to be at this needle exchange. Nobody. That's not a good day for somebody. And the awareness and education that can come out of it, and hopefully treatment, would be incredible.
You know, I want to mention something else. As a young man that I knew, still know, thank goodness, that I've known him since he was a young man. He attended our church, and because of some of the reasons that you discussed, you know, who he was around, where he lived, you know, his economic impact upon his household, whatever the reason, he ended up he ended up in the hospital, and they were cleaning out his heart. He was in his 20s, and I went to see him. And there's only one thing on your mind when you go to see someone that's in that condition. It is not how they got there.
Mm-hmm.
It is not how they got there.
That's right.
It is to fix it and to keep that person from getting back in that situation again.
Yep.
And I think every commissioner up here, you know, believes that, supports that. But it touches everyone in the community. So there's nobody that's sitting on a high horse when we talk about this. You know somebody, you know, either close to you or in your family or your church family or where you work, and it's a big deal. So I didn't mean to talk so much, but there's a couple things on my heart. Figure I'd get them off. If I don't get rid of them, I explode, and they got to deal with me in the back. So we don't want to deal with that. But thank you for coming.
I'll just echo that to say thank you to you and community partners in the room and folks at Health and Human Services who've worked really hard on this. The thoughtfulness of it and the compassion is really evident in the way you're approaching this process. And just to echo that, I do think it's important we talk about addiction and how many lives have been touched by it. My family certainly has. And I think anyone who has struggled with addiction or has loved someone who has knows in a heartbreaking way what that can do to someone's life and to a family, but also what's possible. And that sometimes recovery starts with waking up one day and feeling ready to do one thing you weren't ready to do the day before. So the more I think our community can be creating openings like that and opportunities, and I, you know, this slide that kind of maps out the array of services and supports, I think really demonstrates that. So thank you all for the work going into this and to the partners as well.
I do have a couple of quick questions. So there's 34 counties across the state that have some type of syringe exchange program operating within the counties. 3 of those are operated from county facilities, and so I guess all the others are operated out of some type of private or nonprofit facilities. Is that right?
Yeah, yeah.
And the three counties that are doing some of the operations directly out of their own local government facilities, we said it was Orange County and Cabarrus and
Wilson.
And Wilson.
Mm-hmm.
Okay. And what are I mean, I'm curious, when you think about the you know, the local government facilities versus community, you know, private facilities, I certainly you know, your comment that some folks are not going to come into a government facility, you know, and would naturally maybe be you know, oriented around going to a private facility within the community. When you think about the local government facilities, what are some of the, the pros and cons of thinking about doing it directly from those facilities as well?
So when I think about our model at Health and Human Services, we always talk about being a one-stop shop, right? Where people come and get everything they need. And so I feel like that would fit into that model if you have that sort of robust agency like we will have when we move back to 40 Cox. I think it just fits. It's a public health, so it's just another public health service. I will say that I visited Orange County's health department, and they it's small and it's not very convenient to get to, and they don't do a lot of syringe exchange there. It's pretty low volume. But it's a pretty open lobby, and they walk up to the check-in, and the check-in person gives it. That's kind of their model there. They just ask for a bag, and there's a bag given to them that's pretty much spelled out. Cabarrus County has a little different model, but again, it's like right off the lobby. It's more like yours. It's more like, here's your supplies, pick what you want. Wilson County, I'm still waiting to connect with, but I think they have it within their health department, and then they also partner with a nonprofit that goes out into the community and does maybe more mobile. So I can't say I've been necessarily blown away by the volume that any of these do at this point, and I think that may be because they're housed in a government agency.
Did those counties also have alternative locations as well?
Yes, some of those. I know that I don't know that Wilson does, but I feel that Cabarrus does, and maybe Orange does.
Okay.
And so again, yeah, that may take
Right.
off. They may be sharing the burden, I guess. So.
Okay. And but you feel like you're sort of looking at these gaps. What else can be done in the future? But based on the process you've gone through so far, you feel like there's enough information to be clear that we should, in addition to supporting the partnerships in the community, this is something that should be one place in the community where this is a resource.
I mean, we know that we see people who, because we ask if they use injection drugs, and so we know we're seeing people. And so right now we just give out information about NEPA and STEADY and encourage them to go, but it's that barrier, right? We're putting another barrier in front of them versus if we could just hand them the supplies.
And what do you see as the timeline for that moving forward?
Well, I mean, we're not projected, I don't think, to move back to our 40 Cox building until February. Their current lease space is not, I would say, conducive at all to this. But I think that if we have these next several months to plan it, I would hope that we could initiate that upon entry back into 40 Cox.
Okay.
Yeah.
All right. Well, I also just want to say thanks for the update. I think as we've discussed before, we're just looking for different ways that we can try to make a positive difference on this. And I know that, when this idea first, started getting some more attention, thanks to some of the folks in the community who are really engaged on this issue, it's something that's been, I think, as Commissioner Belcher said, I mean, it's kind of been sort of a controversial idea and probably still is in some regards because it can be seen as sort of enabling this destructive behavior. But when we look at the status quo, and then we see that that not doing something creates its own additional worse problems in some ways. So I'm really supportive of what the county's doing in this arena to both support partners who have been doing it for a long time and then looking at what we can do and should be doing in-house too. So I really appreciate the update. And
Thank you.
I do want to say one other thing, and I do think that, and I know what you meant when you said it about abstinence not being a reality here, but for some people it can be, and it needs to be, and it is a journey that as a county that needs to be, as we look at these things, we need to be prepared to have those conversations, have those discussions, because ultimately we want to help, an individual to reconnect with someone, whether it be family or faith or friends, to where that can become very much a reality for them.
Right.
Because ultimately, that should be the ultimate goal. And during that, then we have to deal with the difficult issues that we are now. But that should be Should be part of our thought process,
is.
needs to be part of our thought process in order for this commissioner to really be
Right.
behind it. So just,
Yes, and I didn't mean to.
I know,
disparage.
I'm not
We
saying-
always talk, I mean, when we're talking about sex or smoking or
understand.
whatever, it's just that's not where, usually when I'm seeing them, that's not where they're at
I
that
understand.
moment.
I know where you,
Yeah.
I know where you're at. I just want to
Yes.
make sure that that was part of the discussion. Thank
Always,
you.
yes. Thank you.
Okay, all right, thank you. Okay, next up is an update on the Justice Resource and Initiative, and Rachel Nygaard will tee us up.
Pausing to see if the slides come up. Good evening again.
Good evening.
Rachel Nygaard. I have the privilege of working as Director of Strategic Partnerships, and in that role, get to work with those partners that are working to increase access to early care and education, to partner with our departments and community organizations on preventing and responding to opioid addiction, and other topics like our criminal justice. So this evening is to provide an update to you about some of the latest work that has been occurring related to criminal justice, and to share with you about an exciting grant opportunity that's before us. We have spent a lot of time over the last year together talking about issues related to criminal justice and justice resource support and coordination. To begin, just setting the stage as a reminder that this is one of the top policy items that this board has established, with the priority being to coordinate a justice system that is efficient, effective, equitable, protects our public safety, and holistically addresses the needs of people who are involved in the system. We approach that priority through a number of activities and goals that are listed here. As we know, Buncombe County has been a leader in these in this arena, as evidenced by a track record of building a really robust array of services. When you look at the national best practices around having trauma-informed justice systems, we have many of the best practices in place. Our commissioners have signed on to the Stepping Up initiative, which is focused on reducing the impact of mental illness and substance abuse disorders in our local detention facility. And we have services from front-end responses, partnering with law enforcement, to services within the jail, diversion programs, a very strong pretrial services program that provides risk assessment, evidence-based risk assessment, and opportunity for supervised release, specialty courts, reentry services, and victim services. Over the last year, like I said, we've been working together pretty closely and intensely. Hired a Justice Resource Coordinator. Tiffany Hanacho is in the room this evening. It's hard to believe that she's been on board less than 12 months. We created a Justice Resource Advisory Council. That's that criminal justice steering committee made up of partners and stakeholders within the system that work together to launch their first initiative, which is the Justice Resource Center, which I'll talk about just a little bit in a second. We expanded our array of programs with the launch of that Justice Resource Center, including diversion, expungement, expedited release protocol to get prosecution services embedded within the jail. And we are on the map nationally with this work. Here's a listing at the end of some of the latest initiatives that we've been connected with through national leading organizations, from the Sequential Intercept model to the Best Practices Academy, Stepping Up Day of Action, and the National Network of Criminal Justice Collaborating Councils, which was a competitive process, and we were recently invited to join. Our Justice Resource Center opened last October and has already served more than 600 people in the center, helping people get access to case management, to diversion services, career navigation and education opportunities, connection to benefits, reentry and expunction, really providing that place of opportunity for people who are involved in the justice system, no matter what place they are with their justice system involvement. We thank the commissioners for your investment in these services and thank those on-site partners that are there every day delivering services with dignity and care to those individuals. So AB Tech, Pisgah Legal Services, RHA Health Services, and Sunrise Community for Recovery and Wellness are all on site. This evening, we're here to talk about the Safety and Justice Challenge, which is supported by the John D. and Catherine T. MacArthur Foundation. This is the national conversation. Here's what they have to say on the topic. The primary purpose of jails is to detain those awaiting trial who are a danger to public safety or a flight risk. Jailing someone who is neither results in huge costs for families and communities, resulting in lost income, parents separated from their children, untreated mental health and substance abuse problems, a greater risk of reoffending, and wasted taxpayer dollars. And so the MacArthur Foundation is setting out to work with jurisdictions across the country to rethink how we use jails. These are borrowed from the MacArthur Foundation materials and point out that jail admissions across the country are high in volume and have increased exponentially over the last couple of decades. And the thing to remember is that most of the people that are in jail, in our local jails, are at a state of their criminal justice involvement where they are legally presumed innocent. They're awaiting trial or resolution of their case through plea negotiation. Many of the people in our jails are there for nonviolent offenses, and we have hard realities to face related to the disparities in our jail and in jails across the country. More people with mental illness and substance abuse disorders are in jail than are represented in the general public. And African Americans are jailed nationally at almost 4 times the rate of white Americans. Our preliminary analysis of local data show that those disparities ring true here in our own community as well. Our own jail, operated by the Office of the Sheriff. Detention facility can house up to 604 individuals. Our average daily population sits at last month just over 500, which is when the jail starts getting full. Based on how those housing units are organized and based on how classification works, we can house between 500 and 600 maximum individuals in the jail at any given time. We have the makeup of those that are in our jail. Again, just like nationally, we see that most people that are in the jail are there at a pretrial status, awaiting resolution of their case. We do house some sentenced individuals through the short state sentences like the state misdemeanor confinement program. We also house for other jurisdictions through contracts like federal. And then the other category is a mix of various things, including the 10 or 15 people that are in the jail on any given day as a result of non-payment of civil non-support, chronic non-payment of child support, and failure to appear in court around that issue. We monitor the trends in our jail and have seen a rise in that pretrial population, and particularly around the female population. We continue to assess data to understand who is in our detention facility, what the drivers are that lead them to be jailed. Of the 7,300 people roughly that were released from the jail over a year's time that was looked at in this analysis, I find this pretty staggering. Almost a third of those individuals had 3 or more releases in that year. Almost a third, 29%. You'll see they're listed, 10% had 5 or more releases in that time. So we know that we have work to do. The particular grant opportunity that we're discussing is related to, it's the Safety and Justice Challenge Grant. Buncombe County was a previous recipient. The Board of Commissioners approved through budget amendment the use of those funds. It was a smaller grant, $50,000, that was funded in our pretrial services program on a specific project related to domestic violence protocol. As a result of our performance on that grant, and as a result of that strong track record that we are we've been invited to apply for the full implementation grant, which is up to $2 million over 2 years. This is a grant that requires system approaches. It requires collaboration from our partners at a level that, at a high intensity level, and has those same emphasis that we have locally around protecting safety and ensuring wellness. Our partners in the newly formed Justice Resource Advisory Council, many of whom are here this evening, and I thank them for their support and their leadership, are here. As a reminder, some of the places of strength that we're beginning from, we have a below average incarceration rate. The work that we've been doing for diversion over the past decades is working. We have slowed the growth and delayed the creation or delayed the need to build a new detention facility. We celebrate that, as well as many of these other items listed here that show the strength that Buncombe County has in criminal justice. We know that we have more work to do. We have growth in our jail population, rising numbers of women in jail. We have, when we look at the number of people that detox, that have a detox protocol while they are staying in our jail, whether that's for opioids or alcohol or anything, those numbers are severely rising. We have lengths of stay for nonviolent charges. We have people who cycle in and out of the jail. We have a lot of growth in our pretrial supervision and want to make sure that we're using that smartly, not over supervising people that don't need a lot of supervision in order to reappear in court and stay safe during their time. We want to make sure that we're using that supervision smartly for those who need it most. And then, like I said, we've got those disparities to face, and we have lack of public confidence in many of the areas within our criminal justice system that we would use this grant to address. Signing on to be a part of the Safety and Justice Challenge means committing to a jail population reduction of 15% or more. That is significant, given that we've been busy doing diversion and jail population reduction efforts for years. The 385 number is smaller than that 500 number that I had up on the screen earlier because it's based on a figure that removes those contract beds and removes the state sentence beds. And so 385 is their baseline, down by 15% or more means an average daily population of 58 fewer people in the jail on an average day. The Justice Resource Advisory Council, together with the staff support team, have been busy working over the past 5 weeks to develop strategies and activities within those strategies. Very many of those follow the conversation that we had with the Board of Commissioners when we met about the detention facility last fall. And we were charged by the board to find, are there any stones that we haven't turned over? Are there any strategies and efforts and reforms going on in other jurisdictions across the country that we haven't yet tried or fully maximized? And we have built a portfolio of strategies that we propose to the Safety and Justice Challenge. And when we submit our application to them, June 15th, that's next Friday, 10 days from now, we will include those with the support of the county and with the support of those justice resource partners. We anticipate that we will join a small number of jurisdictions. There are only 20 communities across the country that are part of this Safety and Justice Challenge at this time, to join them and continue our leadership across the country in criminal justice. Regardless of the outcome of that grant, we are here with you and with the support of our partners working on these efforts over the long haul.
All right, Rachel, thank you very much for that presentation. Any questions from members of the commission? All right, great. Thanks so much. All right, we come to new business. We've got 3 items. The first is a resolution appointing a county attorney. Would, I think this is on us to do this part. So does any commissioner want to tee us off, or I'll be happy to. So I'll just jump in. So we have gone through a process to do interviews and a search process for a new county commission attorney. As I think folks will recollect, Bob Deutsch retired late last year. The position has been vacant since then, so we've gone through a process to advertise for a new attorney that would represent the county commission. And we had a number of really great folks apply, and we've gone through a process, and so that has led us to a resolution to appoint Heather Hockaday to serve as the new county commission attorney. This is considered a part-time position, and are there other comments other commissioners would want to add at this time?
I'll say I've had an opportunity to sit with. I'm gonna do that. Is that good? I would say that I've had an opportunity to visit with Ms. Hockaday and found her to be a good fit, I believe, for a commission. We're needing someone to sit over there. No reflection on Mr. Frew. He's got a big job, but we need someone to sit over there that handles us within here and answers other questions, outside of that, and and I believe she'll do a good job. Her experience comes out of Burnsville, right?
She has represented the town of Burnsville and other local government work. That's correct.
For quite a while. Her, I think as far as Mr. Frew, as far as what we are paying her, that is posted somewhere, or is that not public, or is it?
I think that this board today agreed to any changes that Ms. Hockaday wanted for the service contract, so I think that's a moot point at this point. We can put it out as soon as the board would like.
Yeah.
Yeah.
Ms. Hockaday was going to do those changes and get them back to you.
So we'll do that then.
Okay, everyone, please speak into the microphone. So the contract is a public contract as a person that reports directly to the board. So that is a public contract. So we'll be happy to get that for any members of the public that are interested. I believe, but just to sort of summarize some of the key elements of it, the county is contracting for sort of a base amount of time of 10 hours per week working for the county commission. I'm sorry, 10 hours per
month.
Per month.
Minimum.
I'm sorry. Thank you
That's
for
minimum.
Thank you for making sure I get it right. And then would be compensated on an hourly basis at $150 an hour for any time above and beyond that. Did I get the rest of it right?
That's correct.
Okay, great. All right. Any other questions or comments from the board? We will take public comment on this once there's a motion.
I'll make a motion to approve.
All right. There's a motion and a second to appoint Heather Hockaday as the Buncombe County Commission attorney. Mr. Yelton.
Brownie, I thank you for your reply. I did it private, so I'll do it in public. Because when you do something good, I tell you that. When you do something bad, I tell you that. I don't want to change. Appreciate you taking public comment on it. I also appreciate you having this as at least a resolution and not under the consent agenda. We know we went through that one time. And I think it's good it's there. I would also suggest that I would like to have a copy of the contract, and I appreciate you making that available. But based upon some information that the Citizen Times just released, I think you better start another search for another attorney that can prosecute federal fraud and laundering of money. Because it might get some money back for you. You might not have to pay that person as much as you could get back. And if you don't know what I mean, I think you do, because you've been back there behind closed doors talking. And I want to caution you about what goes on in closed door meetings, because the general statute says after the action occurs, I don't want to know who you're interviewing, but after the action occurs and this contract's signed, the minutes of that closed session, you should be able to read them and understand what went on. And I've already told your county manager, I've always seen from Joe Conley days that never done. It's always been redacted, shall we say, by the legal department. And I think you need to keep an eye on that, because you know, as long as I'm alive, I'll be reminding you of that and thanking you for the checkbook and looking for the cost of each library per library. Because if you break out your units and you monitor their cost per unit at the ground level, you won't have abuse of big money. Thank you.
All right, thank you. Mr. Rice.
Thank you, Mr. Chairman, members of the board. Don't ever count me and Don out. We've been sitting back there. We've evaluated you already. You know, if you got evaluation from us, you don't look too good in the general public, you know. Did you hear that? I mean, for us to get the news before you do, tell us, you know, that's pretty good. Anyway, this attorney that you're wanting to appoint, I think the contract should be put out for people to look at before you actually hire, to see if there's anybody in the community that might have something that you don't know about, and it don't be an embarrassment to you when you do find out. Did you get that? Because all the stuff you do behind closed doors don't always bring out things that might be to your benefit, knowing. These background checks don't show everything. And don't ever think attorneys ain't got some nasty stuff in their closets. Because if you don't know that, you don't need to be sitting up there. I have a general question. If you're going to pay this attorney $109 an hour for, is that right? After
150
the 10 hours.
Yes.
on an
Okay.
hourly basis after the first 10 hours. yeah.
All right. Now, if you're going to include her travel time, and if she lives in Burnsville, we're going to burn a lot of money up if you're going to travel time. So I want to know if that is part of it. Because that's a long way to come, and when we got a town full of lawyers. Of course, I'd say this, I admire a lawyer for not taking the job instead of taking it. I think we need to do a national search like me and Mr. Yelton is wanting. To get, you know, you get what you pay for.
Thank you.
Oh, me.
All right. Thank you all for your comments. One clarification, Ms. Hockaday lives in Weaverville. She works she's done work for the town of Burnsville, but she lives in Weaverville.
Yeah.
All right.
You're good, Jerry. She's safe on the drive.
Any other questions or comments from the board?
Yeah. Well, it depends on the time of the day, yeah.
All right. Okay, all in favor, and we will get that contract out, released very soon. All in favor, please say aye.
Aye.
Any opposed? All right. And Ms. Hockaday, if you would wave your hand so everyone can meet you. She's a very nice person. And you'll
See, we like her already. She's got your number, see.
okay. All right. Welcome aboard, Ms. Hockaday. We look forward to working with you. All right, the next item is the appointment of an interim finance director, and Eric, I'm sorry?
Oh, I'm sorry.
If you guys don't mind, we do have we have that item that we added, and then the Zeugner pool.
Okay,
But since we're
all
just on these
Yeah.
appointments,
Okay.
I thought we would just go ahead and do that one now, if that's all right. So the recommendation is to appoint Eric Hardy as an interim finance director. The county will be doing a search process for a new financial officer. And so is there a motion to appoint Eric Hardy as the interim?
I so move.
Second?
All right, there's a motion and a second to appoint Eric Hardy as the interim finance director. Are there any members of the public who would like to comment? All right, all in favor, say aye.
Aye.
All right, thank you. And Tim, we want to acknowledge your service, so thank you very much. And we appreciate your 10 years of work for Buncombe County. Okay, last item under new business. Resolution authorizing payments for maintenance and operation of the Zeugner pool. And Michael Frew will, Jim Holland will take this item.
Mr. Chairman, Commissioners, thank you. When the replacement for Zeugner was approved by the commission, at that time, you turned over the operation and maintenance of the existing Zeugner pool to the Buncombe County Schools. At that time, through a resolution, you approved up to $150,000 per year to pay the schools for the maintenance and operation of Zeugner during the construction of the new pool. That resolution authorized those payments until June 30th of 2017. Those payments averaged about $65,000 each year. The new pool is scheduled for completion the first of the calendar year 2019. In order for the Buncombe County Schools has continued to provide the maintenance and the operational payments for Zeugner as it currently exists. And it is our opinion that in order for us to make those payments for the maintenance and operation of Zeugner until the new pool is complete, it will require authorization by you through a resolution to make those payments. And this resolution is asking you to authorize a payment of no more than $63,000 for this fiscal year, and no more than $40,625 for FY19. We have already identified the funds both for this year and for the next year, and it's not requiring an increase in appropriation by the board.
So I got a question. The Zeugner pool was a community pool for a long, long time, so it's still going to maintain the community access
They have.
before?
They have both for the existing pool and for the new
For
pool.
the new
They
pool.
were doing that.
Okay. I'll move approval.
I'll second.
There's a motion and a second for a resolution authorizing payment for the maintenance and operation of Zeugner pool. Are there any members of the public who would like to comment? All in favor of the motion, please say aye.
Aye.
Any opposed? All right, thank you. Board appointments, we have one vacancy to the Mountain Area Workforce Development Board.
I'll nominate Trudy Logan. Wait a minute, Brandon. Do I
Yes,
still have
sir.
to go public comment before that?
Oh, thank you very much. We got more public comment. Thank you very much. I'm sorry, I jumped over it. It's written differently on my sheet here. All right, the time limit for individual comment to the board's 3 minutes. Are there any additional members of the public who would like to comment? Mr. Rice, followed by Mr. Yelton, and then Chu.
Anybody else?
Hey,
Like
Jerry,
big-
hey, Jerry, could you lean into that mic a little bit? I couldn't hear you real good last time.
Thank you, Joe.
You're welcome, sir.
Is that good enough?
Yes, sir.
Take his minutes, not mine. Finishing up on my public comment for the board. While the fund balance, school fund balance of the system, both systems, continues to grow by millions with a S, the classroom teacher should not worry about the need of their kids and supplies with millions of dollars in their fund balance. They went to Raleigh on this thing, you know, and their school board has got millions of dollars sitting over there, and they wouldn't even offer it. The teachers ought to know that. I've spoke to a lot of teachers, and they didn't even know they had that in the fund balance. Shame on them. They ain't got good math teachers, I guess. Salary supplement should not be, or it should be, to retain the best teachers. Yes, I agree. But to have a state-run school system, the teachers have enjoyed increases more than the county staff and the average household has enjoyed. There is a way to correct this problem now, not next year, without hurting anyone. The first step, give me the policy. And I want to see you get the policy because you ain't got it. I want you to work on a policy that's going to spell out specific and it be separate to the current expense because all counties do not get this money. There's 5 counties that don't even get supplements. This should not be lumped into the current expense. This should be something that you talk in consideration every year. I've already talked to the finance director on one of the schools. They said they do not have any policy and they do not have any requirements. The only thing they got to do is give the amount they want to give to the county. I've got it in writing if you want to see it. Now, if you had a policy in place, the school fund balance could not have got to the point that it's got. It stayed at $6 million for years, and I'm talking about I made a presentation in '97 on exactly what I'm standing here and telling you commissioners on what was going to happen, and it's happened more times than one. It takes an idiot, and I don't think we got them sitting up there. I'm going to say yous are ignorant. I think it's politics. I do not think it's financially responsible for what you've been doing with this fund balance. And I want it to be in an open meeting here and talk about a policy on this very subject.
Thank you. Mr. Yelton.
I walked up while Jerry's going back to save a little time because I'm sure you all are in a hurry to get out of here and go to your closed door meeting. And then you're going to talk real good. But Tim, I was just getting used to you, and here you are leaving. Thank you for the questions you ask, and you know what I'm talking about. I appreciate it. Okay? Because that's in the article too. But I wanted to bring another solution to you. I mentioned this before, Mike, and I think as I went through the budget, I saw that our buildings are in bad shape. If you've not read the budget details, you need to read it. Water is penetrating the buildings. Yes, Allport building, the one over here on at the corner of the avenue there, where the old county commissioner's office used to be. You're going to have to replace the chiller in the Justice building, and it's only 5 years old because it's not doing capacity. So if it's not reaching capacity, somebody misdesigned it, or there was enough change orders, which normally happens in a contract, to exceed the capacity of the chiller. And if that happened, then your general contractor should have caught it. So I think you need to look at starting a program on maintenance at AB Tech. I'm dead serious about it, folks. You got apartment buildings going all over the county. Somebody's going to have to be able to monitor the heating and the cooling, the plumbing, repair work. What's going on in the windows? Repair windows. And if you don't have that course over there, Mike, start pulling some strings and get it. Because these industry and these plants are going to need maintenance people too. And that is a job that will pay well in the future, because you have a hard time right now finding anybody to do any maintenance work. We're to the point now where if you've got a pickup truck, a cell phone, and a toolbox in the back, you're a builder. And it was this way one time before. And you know what that caused too, Al. You made a lot of bad loans on houses that weren't built right. So I suggest strongly that you start that program at AB Tech. That's right up there with an open checkbook, and right up there with the libraries being individually accountable, and that's right up there with everything else that you oversee being individually accountable at the bottom level. And then you'll have the facts and the figures you need, and we might create some good jobs. Thank you.
Thank you. Okay.
Don? Mr. Yelton? I am working at AB Tech very hard to be able to try to, and have, as far as maintenance, getting maintenance through the Linamar and trying to get maintenance people to be able to have jobs. It's been hard, but I've been working hard at it. That's the best I can tell you.
I think we need to get the schools involved like they did at Pisgah. If you want some money back here, make him work for it.
All right. Thank you. All right.
Is this general public comment or
Yes.
is that after? Okay.
No, this is it.
Great, thanks. Hi, I'm Hillary Brown. I'm with the Study Collective. Jennifer spoke a little bit about what we do. And I just wanted to come tonight to thank y'all for the funding that we've received in the past from you. We received $20,000 last year, and I want to ask that you double it this year. And I want to tell you a little bit about why. In the first quarter of this year, there were 935 reversals reported to the state. 101 of those were done by studies participants. So a tenth of the reversals for opioid overdoses that were done in the state were done here by participants of study. We pass out naloxone to folks who are actively using. So all of those reversals are happening from folks who receive services from our program and are actively using. We also passed out 73,000 syringes last year, as Jennifer noted, and we did 27,000 this first quarter, which means this year we will do 35,000 more syringes than we did last year. We're also now doing fentanyl strip testing, so folks who are using drugs can test their drugs to make sure it doesn't contain fentanyl or a fentanyl analog to help prevent overdose. Today, I was at Exchange, and we had 8 positive reports just today of fentanyl being present in the drugs that folks are using. 6 of those were heroin, 1 was Xanax, and 1 was meth. So that shows you how prevalent fentanyl is in the drugs that folks are using in town. We need more funding because the crisis is getting worse. We are having to do more work, and the need is just not being met. And I know that the opioid crisis is one of the county commissioners' 6 most important issues that they're focusing on. And we need that part of that money allocated for the opioid crisis to be allocated for harm reduction, because we really are the first line. We're meeting people where they are, and we're meeting folks in active use. So I thank y'all for listening to me. I'm gonna hand y'all some stats just so you have those. Thank you.
Okay, great. Thanks, Hillary. Michael?
Good evening, Commissioners, Chairman. My name is Michael Harney. I work at the Western North Carolina AIDS Project. I also teach Spanish at AB Tech and at Blue Ridge Community College. And I am a co-founder with a gentleman by the name of Marty Prairie of the Needle Exchange Program of Asheville. We started that in 1994. So if indeed we could have needle exchange and syringe exchange and safe disposal provided at our local health department, it'd be 25 years in the making. And I, like Mr. Yelton, am not going away anytime soon in my planning. I will be back and to visit you, and I'll answer questions. I hope to consult, along with the Study Collective's professionals, with the county health department to understand what it is that they can do, what they should be doing, how to do it best, the best practices that we've learned all these years. I would highly encourage you, all of us who are listening to this, to go to the website www.aids2018.org. That is to the International AIDS Conference, which will be held in Amsterdam this summer. There'll be high science there, and all sorts of questions may be answered about harm reduction, about the vulnerable populations of injecting drug users, among the others that I've mentioned here before. There's also a conference coming up, the U.S. Conference on AIDS. It'll be held in Orlando. It's another opportunity for you to be educated about the issues and the real reason that we even started needle exchange in the first place, the reason I'm wearing this red ribbon is because of HIV/AIDS awareness. And so I wear that for prevention. I wear the yellow ribbon for hepatitis C prevention. These were tools that were kind of implemented, mottos that people used over the years. There's one final conference that I think you may be of interest knowing about, and that is the National Harm Reduction Conference. It will be held in New Orleans this year in October. And I would challenge you, if somebody would match me, and if they wouldn't, I will provide a grant for one county commissioner to attend that conference. If they would like to go, I will make sure that I pay for that completely: hotel accommodations, travel, and the conference registration. It is so important to me that we see harm reduction and the vulnerable populations that we serve at the Needle Exchange Program of Asheville, at the Steady Collective, at the Full Circle Recovery Center, and hopefully at our health department and all health departments in Western North Carolina, all 85 of them across the state of North Carolina. It is so important that we take this seriously, and I am grateful to you for taking it seriously. I'm grateful to the health department, the health director here in Buncombe County for taking this seriously, for hearing me out, and for putting up with me, and for what I don't believe are my shenanigans, but certainly my compassion for the people that we serve. They are human beings, and at no point do they lose their humanity. They deserve dignity. They deserve respect. They deserve all that we can do to provide the health care services that we can provide to them, and I am grateful to you all. I am grateful to you, Jennifer, for making this. I am grateful to my colleagues Michelle and to the Steady Collective Hillary and to other people in our community who are doing this work. I thank you again, and I'll see you one more time, I'm sure, before February, when we perhaps will implement needle exchange at our county health department. Thank you very much.
Thank you, Michael.
Good evening. Hello, my name is Dr. Bela Ostrak. I'm a medical anthropologist and a research scientist at MAHEC, and I study HIV and hepatitis C interactions and harm reduction. And I just wanted to echo actually what other folks have said tonight about the importance of community-based, trusted syringe access programs where participants know and trust the people that they're coming to for these services. All of the existing research nationally, internationally, and in this region, actually much of it has been done in Appalachia and in the South, shows that people are more likely to engage with these services in ways that are going to result in a reduction in disease transmission, and specifically in a reduction in overdose when they're coming to a community-based exchange that is not in a county health department or in a government facility. They're more likely to come to a site where they know and trust people. And we know that not just locally, but from existing published peer-reviewed evidence-based research. Specifically, there are articles that I can get you the citations for. I can get you the full articles if you want those, showing a major concern that Jennifer mentioned: policing activity and police presence near a syringe access program is associated with more risky injecting behavior and is associated specifically with an increase in disease transmission and an increase in overdose. And people are actually less likely to use a syringe access program if it's in a building where there is police activity. And we also know that syringe access participants report that their overdose and safe injecting supplies, their overdose response medication and injecting supplies are often confiscated by law enforcement folks, which is illegal. And that happens nationally. There are a lot of articles about this at places where it's been going on for a long time, but we're also hearing that locally. In addition to the research that I do, I'm also a volunteer with the Steady Collective, so Hillary could speak to this more directly. But it's something that we know has been happening locally. So all of that is just to say that it explains why some of these community-based programs are more trusted and people are more likely to go there and actually get the naloxone and the overdose response medications and the safe injecting supplies. So while we certainly understand why people want to have these services in county health departments, there is actually a 4th county health department that has these services. I was there earlier today in Cherokee. Obviously, it's a different funding model. It's tribal health, but that program started in February, so I was there meeting with some of the staff today. They have some specific unique challenges. It's a different environment, but it would be another model to look at. But there are advantages and disadvantages that are important to understand. But we know that there's a model that works, and it's a community-based, trusted model. We know folks are going there. We know people are using those services. So I think, there's an expression about if it ain't broke, don't fix it. Please continue funding what we know is working, where we know people are going. Continue funding it. Fund it at a level that'll work, particularly while you're exploring something else. So if you're thinking about doing something new and additional, as you're exploring how that could look, please continue funding what you know is working. Thank you.
Thank you. Kim?
I'm Caitlin Johnson, and I'm a teacher for Buncombe County Schools. I teach early childhood education to high school students who are interested in working with young children, and I also serve as the director for our in-house preschool. We are one of 4 of these programs in Buncombe County Schools. However, we are only one of 19 in the state, so we're pretty special. It was extremely exciting when many of you came out to visit us, and we appreciate that. I work in early childhood education by chance. When I earned my undergraduate degree, my intention was to be an elementary school teacher. However, my program included enough credits for a dual license in elementary and early childhood, as there were more early childhood jobs out there, and my college understood that. It was by chance that while I was at Robertson High School one day, I saw a small preschool playground and began asking questions, and that's when I learned about the high school early childhood programs. It was also by chance that Irwin High needed a secondary ECE teacher that same year, and I was chosen for the position. As a professional, I've received continuous guidance from Buncombe Partnership for Children, and by chance, at 6 months pregnant, they asked me if I wanted a free master's degree through the Teach Scholarship, a scholarship program for potential and current early childhood professionals, and I took it. For the past 2.5 years, I've been working on an ECE degree in leadership, policy, and advocacy without accruing any college debt, and that has allowed me to be a full-time teacher, mom, and graduate student. While studying, I found myself watching the ECE workforce session where Ms. Beach-Ferreira asked the question, what is working with regards to the early childhood education workforce? And I knew I had some answers to that with our program. At the end of that session, Ms. Nygaard's email was posted, and I contacted her, and it was then her who took the chance on me as an intern. And currently, I'm working on a case study on Buncombe County's progress with workforce development with regards to early childhood, and should complete my degree in July. While my story is nice to hear, I tell it because I'm a product of the work you are doing every day for our children, families, and for making our early childhood education a priority. The work you are doing is giving more people more opportunities, and it directly impacts me and the students I work with every single day, so thank you. As I said, it was by chance that I ended up here, but however, when I look at it more closely, it's truly opportunity why I'm here. Opportunities like the one I have seized with the Teach Scholarship, or the ones that we heard about earlier tonight. These people, you are providing people with a good life and a solid future with these opportunities. In 2015, an evaluation of the Teach Scholarship Program found that 54% of the Teach Early Childhood participants were not working on a degree before they learned about the project, and I'm one of those people. I was not planning on getting a master's degree in early childhood. So in the words of Ms. Nygaard, that shows us that when we create passive opportunities, people will step into them. So commissioners, I commend you for your work to minimize those by chance moments and intentionally create opportunities for people to step into. Thank you.
Thank you.
Good evening. My name is Kim Roney, and I'm a piano teacher and service industry worker that lives in West Asheville in District 1. I came here today to watch the budget hearing, and I wasn't planning to speak on this, but I wanted to amplify the voices of Michael and the folks from the Steady Collective. I am thankful that we're looking at a pilot program with another location, especially one where folks are already coming to Buncombe Health and Human Services. But I also heard in the presentation that we need trusted resources and to meet people where they are. So as a taxpayer, it seems like it would lessen the bureaucracy, but also amplify the efforts if we can meet people where they are and increase the efforts and funding for the Steady Collective and through NCAP. So thank you for that consideration.
Thank you. Okay. All right. Let's go to board appointments. We've got an opening on the Mountain Area Workforce Development Board, 1 vacancy.
Trudy Logan.
All in favor, please say aye. Aye. Any opposed? Agricultural Advisory Board, 1 vacancy. All in favor of Gary Roberts, please say aye.
Aye.
Any opposed? All right, we've got a couple of brief announcements. June 12th at 10 a.m., the commissioners will attend the Mission Health Update at 200 College Street in downtown Asheville, and that will be a joint, Mandy, that'll be a joint meeting with the Asheville City Council, right? So there'll be a joint meeting with Asheville City Council and the County Commission on June 12th at 10 a.m. to receive an update regarding the Mission Health acquisition by HCA. And that's on the first floor here at 200 College Street. On June 19th at 5 p.m., the County Commissioners will hold a regular meeting at 200 College Street in room 326. We do have a need for a closed session. Mr. Frew.
Yes, sir. Mr. Chairman, Commissioners, we had 1 item. We now have 2 items pursuant to 143, 318, 11A3. One is regarding the United States of America versus Wanda S. Green, docket number 18 CR 68, bill of indictment. The other is to get direction from the board on another legal matter, and I think we need to leave the door open to take further action.
Okay, so we may take further action when we come back out of closed session, to be determined.
Yes, sir.
All right. We need a motion to go into closed session.
So moved.
All in favor, please say aye. Aye. All right, we're in closed session.